Thank you very much, Mr. Stradom. Now, know your status is a phrase that's often used around the importance of HIV testing and knowing one's HIV status. But not many people in South Africa can afford private health care. Now, in the wake of World AIDS Day, the Western Cape Department of Health has expanded its health service, offering HIV counselling and testing at iKapa Care's outlets in the province. And joining us this morning is Western Cape Ministry of Health's Dr. Noma French Mbombo and Public Health Specialist Marina Rifkin to tell us why this service is such a vital part of encouraging people to know their status. Thank you so much for joining us this morning.
Thank you. Good morning.
Now, this is a very, very important thing because the iKapa Cares program, as I understand, boasts itself as an initiative that is a partnership between provincial government and the private sector as well. That's going to be increasing the services available out there to create awareness in healthcare. When was this program initiated and what is this specific operation aimed to achieve?
Okay, thank you. For the HCT, which is the HIV counselling and testing, it's just been introduced and it is the only one actually in the country. But previously, we do have other wellness centers through the private sector, which is the clinics, the DISCAM and other pharmacies throughout the province. More than 120. But now we are including HIV/AIDS testing as part of it.
Okay.
And what is important is that we are improving access to health care in order to achieve the 90-90-90 strategy, which is the United Nations guidelines, where we say 90% of the population should be able to know their HIV status by 2030. But in order to do so, you will need to have partnerships. Yes. For example, in this case, we've got a partnership with the private sector, especially to reach out for those communities where they won't be able to come to the health services. For example, you get clinics, this came mostly in the malls and mostly in the communities, and some people are working, they don't have time to come to the clinics. And some of them, because of the stigma, they don't want to stand there in the queue. But now, when you create that environment where people can have an access, it makes it easier. Yeah. And also, what is best about it is not about only just go and test, but also there's a referral system that is improved. For example, in case you might need the treatment, for example, the ARVs.
Yes. Now, how is, in this program, is it going to be done differently to encourage people to go out there and get tested and get counselling?
So I think one of the benefits of this program is convenience in terms of bringing HIV counselling testing services to where people socialize or shop. Yes. So as the minister mentioned, many of these retail pharmacies are in malls, and so it is a convenient service. It takes 20 to 30 minutes of somebody's time. It's high quality. It's provided by professional trained nurses in a private and confidential setting with high quality commodities provided by the Department of Health. And this is where the partnership is really exciting. It's the Department of Health providing the HIV test kits and the retail pharmacies providing the nurses who deliver the services. And it links in with the national system. So the goal is to expand access to HIV counseling and testing. Some people will choose to access free services at public health clinics. Some people don't have the time to access those services at public health clinics and would rather access them at a retail outlet. We're really targeting this program at workers. People that want access to health care, maybe don't have private medical aid, but also are employed so can't take the time off to wait at a Department of Health clinic. So really the goal is to increase access, and we're partnering with a variety of retail pharmacies. And through working together, we're trying to increase the number of people in this country who know their status.
Exactly. And so with saying that you're targeting workers, are you saying the services are only available to them, or is it to anyone and anybody who wants to know their status?
To anyone, because you find that, for example, when you come to the malls, it's mostly youngsters who go there. And also for the people who are working, because you don't have to take time off and go to the clinic. And you know that in terms of the queues and all of those. So it's caters for everyone. And also even with couples, which is most important.
Yes.
And also in those pharmacies and also in those retailers, already there is a family planning to access contraceptives. Fantastic. So you can get the whole package on sexual and reproductive health.
So that whole package, how much will it cost me if I want to go there and get tested and get counselling and know my status?
So HIV counselling and testing is no more than 60 Rand. And I say no more than 60 Rand because some pharmacy outlets actually are charging much less.
Okay.
Some pharmacy outlets are actually offering the service free 1 day a week. So really it's no more than 60 Rand. And we encourage you to look for an iKapa Cares Clinic if you're living in the city of Cape Town. But the goal is to expand this program in the Western Cape, but also to challenge other provinces and the private sector in the other provinces to think about these kinds of public-private partnerships.
Yeah. So what happens is that if I go to a mall and I see a clinic that is marked with the iKapa Cares logo, I know that these services are available from there.
Yes, no. When you see a retail shop like the Clicks, Discount and so on, then you'll know that you'll get that access to
Well, ladies, thank you so much. I think this is an incredible partnership that you've forged together, and I think that it only serves to serve our community and our country at the end of the day. So thank you very, very much.
Thank you for having us.
Well, there you have it. The iKapa Cares outlets do aim to inject new vigour into caring for the HIV positive by offering testing and counselling at an affordable price, something that is really, really necessary for building our Rainbow Nation going forward. Well, right now it's time for us to take a quick break, and we'll be right back.